Hi, I'm Edward McEachern, Chief Medical Officer for Pacific Source Health Plans. Today I want to talk about some tips and tricks for surviving the holidays with COVID, not with your in-laws. We have kind of a train wreck going on right now in our society. We've moved from 10 million infections to 11 million infections in about a week. And if you recall, that's longer than the month it took us to get from 9 million to 10 million infections in the United States. We're snug up on about 250,000 deaths in the United States. Now that might not seem like a really big number for a country that has about 340 million people, but it's a big number. The number one cause of death in the United States is cardiovascular disease, and that's about 650,000 deaths a year. Snug on close to that is cancer deaths, right at about 600. COVID today is the third leading cause of death at about 250,000 deaths. And it's about 60,000 deaths higher than the next most common cause of death. Said a little bit different way, it's more deaths than were experienced by all commercial plane crashes in the world, plus all the car crashes in the United States, plus all the suicides in the United States, plus all of the deaths due to opioid overdoses in the United States, almost by double. So it's a big deal. So what can we do about that? Well, COVID rates are at all-time high, and we're starting to go into the influenza season. Hospitals and healthcare workers are having a really hard time because they have about a third of the deaths and a third of the infections from COVID to date. The spread is beyond the capacity that we have to contain it and test and trace. And what's driving that mostly is small intergenerational gatherings, which would be something similar to what you'd see at Thanksgiving dinner. And what you're also seeing is that the young people are getting sick, and it's not so much of a sickness for them. They're surviving it by and large, but the older people, those people in their 6th, 7th, 8th, and beyond decades, are getting it and dying it. And so as you think about the holidays, maybe we've got these 2 vaccines that are kind of rounding the corner, and we're doing some really good work with those vaccines. They're probably going to be here the first and second quarters of 2021. And so maybe the thinking you ought to think about is, who can I celebrate with next year that if we celebrated this year, they might not make it to next year if they were to get the disease? There's a lot of talk about the 2 vaccines that are coming out of the phase 3 trials. They seem to be very successful, 90 to 95% effectiveness. Both of the ones that are out now, Moderna and Pfizer, are two-step vaccines. And I think we're going to see some really good stuff to do with those in the beginning of the year. But between now and then, I've got a few suggestions so we can be safe over the holidays so that we don't actually infect people. So I've got some practical advice. Number 1 suggestion, maximize your efforts using preventative measures. We all know what this means: distancing, masks, outdoor seating if you can do it, avoid large gatherings, wash your hands, and clean the surfaces that you eat off of. Number 2, people, place, time, and space. Know how this works. The more tightly packed people are in a smaller space, the more time you spend with them, the more likely are you to get exposed to COVID if it's around. And so being within 6 feet of somebody for 15 minutes, even if it's outside, you stand a pretty good chance of getting that COVID. The size of the gathering that you have, hopefully you'll do this virtually, but if you have to have one, do a small one. And if it's people outside your bubble, you may want to inquire pretty carefully about how their bubble has been doing around this work. Number 3, even with families and friends, keep your distance, wear a mask. And when you have, especially folks of different generations, be particularly careful about how you actually interrelate with one another. There was an example recently published by the CDC of a small gathering in Maine at a wedding that led to, I think it was 187 cases and about 11 deaths. And it was one of those things that people were just having a good time at a wedding, and it ended up in a tragedy. Number 4, wear your masks. One of the things that you may want to do is use a mask that is not cloth, but upgrade it to an N95 or one of the surgical layered masks that you can find. Give them as gifts. It protects you and your loved ones as you go along. Number 5, travel only if you must. Air travel is relatively safe. What's not safe is the airport. It's a higher risk event. Buses, public transportation, and trains are all kind of dangerous. Encourage travel is safer, except when you're traveling with people who are outside your normal little bubble. Cars don't have HEPA filters, and so if you're traveling with somebody who is outside of your bubble, you're going to be exposed to their respiratory pathogens if they have them. Virtual this year, number 6. Virtual this year is probably a better idea than in person if you can do it. If you have the opportunity to have a small, in-person virtual meeting as opposed to in-person actual meeting, you'll probably do yourself a favor. Think about next year and what you might be willing to trade this year for having those people who, if they get sick, will be at a high chance of getting really sick or dying. And you may want to think about what that looks like in about a year. Number 7, when you go home, if you travel, be aware that you might have been exposed and be thinking about flu-like symptoms and how you might want to quarantine if you're around people who are at risk for trouble. And finally, if you are exposed, we've talked before about how you should stay in a quarantine environment for a period of 7 to 14 days around symptoms. We'll give you the CDC website for advice around that. 3 parting thoughts. Yep, we're all COVID fatigued. I hate it, you hate it, we all hate it. But COVID health equals economic health, and economic health equals COVID health. The longer we're able to stay healthy, the more the economy stays in its functional state. Number 2, healthcare workers are getting jaded, tired, burnt out, and the capacity that they have to take care of you and your loved ones is diminishing as the increased number of people show up in the hospital and the healthcare workers get sick. And number 3, there are a couple vaccines coming out in the next quarter or 2. Think about the loved ones that you might miss next year at next Thanksgiving if they get COVID and die this year. The next 2 weeks and how we live determines a lot about how we will live in the future. Thank you. I'm Edward McEachern, the Chief Medical Officer for Pacific Source Health Plans. If this has been helpful, share it with a few friends.